I was a very chill, lax parent, go with the flow. After birth trauma, I feel like I'm in a constant state of fight or flight, and I'm like a helicopter. I was never a helicopter before. I have a lot of health anxiety surrounding Alec, and I'm always worried that something is happening. And it's like, is it because of what happened when he was born? And like I always revert back to that, and he gets sick and I'm panicked, which I wasn't before.
In today's episode, I'm joined by Nicolette, who is a mama friend I met through Instagram. She and her husband have 2 kids, ages 11 and almost 2. If you missed the last episode, definitely make sure to go back and listen to it. We went through her I had no idea moments throughout parenthood so far. And today, we're going to be picking up right where we left off and going through her parenting experiences both before and after suffering birth trauma and PTSD. We'll also catch up with her on how things are going for her at home and now being back at work. So we're going to dive right in and get started. So I feel like you have a little bit of an interesting perspective. Again, you had parenting before birth trauma and PTSD and after. So what are the kind of differences between your parenting journeys in that respect?
So before, it's so funny. It's like before me, after me.
Yeah,
so
right.
Before me, I was a very like chill, lax parent, like go with the flow. She got hurt. It was like, you're good. Come here. Let's clean it up. Everything's going to be okay. She got sick. I never worried. And I felt like that really helped contribute to her and her like self-awareness and emotional awareness and stuff like that. And then after birth trauma, it's like this, I feel like I'm in a constant state of fight or flight. And I'm like a helicopter around Alec, which like, I was never a helicopter before. I have like a lot of health anxiety surrounding Alec, and I'm always worried that like something is happening. And it's like, is it because of the brain injury? Like, is it because of how he was born? Is it because of what happened when he was born? And like, I always revert back to that, and he gets sick and I'm panicked, which I wasn't before. I'm like checking his lung sounds. I'm like looking, does he have intercostal retractions? Like what is, what is going on? Is he breathing? And I'm freaking out. Even if he sleeps in, I'm like, is he alive? And this was not my default before that. Obviously I work with my therapist on this, and I was just like, I have to tell myself like, we're safe. We survived. He's healthy. And we are not there anymore. He was given a clean bill of health. Everything is okay. But it's so hard sometimes because your brain is telling you like, no, something's wrong. Something's wrong. So, I had like anxiety before. I mean, who doesn't, right? Have a little bit of anxiety. But now it's just like, it's gotten more severe, particularly around him.
Okay.
Which I feel bad because I'm like, I don't want Mina to think it's like, oh, I love him more. It's not that. It's just I am more worried for his health and well-being because he was given such a poor prognosis at birth. It's like I said, I just can't believe that he's okay.
Right.
So it's like I'm always looking for something to be wrong, And I'm grateful when I'm like, oh no, he's fine. And I like get I get a hold of myself and I'm like, he's okay. Or Serge talks me off the edge. He's fine. He's fine. And then I'm like, okay, so I haven't gotten past that. Like otherwise, I do have to be a little more firm with him than I was with Mina, because again, he's the boy who was climbing up the wall and jumping off the roof and like all that stuff. So that's different. Trying to find boy mom me, I kind of still do have like some people are like, oh my God, don't let him touch that. And I'm like, I don't care. Germs, it's good for them. Right. Like things like that. I'm still the same. It's just, there's, I battle with that like helicopter health anxiety with him. Yeah.
Yeah. Actually, one of my friends is actually kind of going through that right now too. And she's struggling like a lot. Like her second was also, much more traumatic. And then now her first is going through like asthma and stuff. And just the health anxiety from that birth and like trying to manage that. It's a lot.
It's a lot.
Do you see that a lot, like with people that are going through birth trauma, like that kind of almost health anxiety, that side that comes out.
Yeah. Oh yeah. Because the labor is, you're having your babies, and whatever traumatic experience it was, it's like has to do with your baby. So it's
right. Yeah. It makes sense. Makes a lot of sense.
I actually recently started Zoloft in November, which was something that I was very like almost proud that like I wasn't on meds, but it was one of those things that, people were like, you're so strong. So I was like, I'm so strong. I don't need meds, blah, 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 but I did. It came to like a crashing point where I was in a mental health crisis. And I was like, I need help. And I'm very happy that I recognized that, because I'm not really sure that the outcome would have been great. So I started Zoloft, and it's helped a lot. He was like sick a lot at one point, and I was dealing with it a lot better than I was before. The Zoloft has helped my mood tremendously. I'm on like the lowest dose. And it's like it's like it's almost like, oh, there's who I used to be, Yeah. And then I think, a lot of people in the birth trauma world have health anxiety or don't go to the doctor because of the birth trauma they experience. I've had traumatic experiences post birth trauma at appointments, not because the appointments themselves were traumatic, but just because of like flashbacks, being laid down, bright lights over me, like pain, things like that, or not feeling in control. These things bring up a lot of anxiety and a lot of flashbacks and a lot of trauma. So it's big. It's real. It's big. I remember my first dentist appointment post everything, and I was in the parking lot crying and on the phone with my therapist because I was like, I can't go in. Or my follow-up OB, it was my annual when I went for my first pap smear. Yeah. And I was like, okay, gonna lay down. We were chit-chat because I work with my OB, we're cool. I went to lay down, and then I shot up and I was like, I don't know if I could do this. And he was like, what? I'm like, I'm freaking out. He's like, right now? I'm like, right now. And he's like, okay. Okay. All right. Okay. All right. And we just like, I was like, I just need a minute. I just need a minute. And he was like, okay. And I don't think he'd ever seen me like that. So he was like, he's not the best with the mental health stuff. Like he was like, you're seeing your therapist, right? And I was like, yes. I don't know what to do. I don't know what to do, because he's traumatized too. And I just was like, I just need a minute. And he was like, okay, we'll go slow. I'll talk you through it. And it was like, it was just like a flashback to when they were trying to figure out what was wrong with me. And another doctor, not him, like checked me really fast. And like, I didn't have this memory until like later, like that it was super painful. And like in the middle of me feeling like my throat was closing, I couldn't breathe and I couldn't see, I'm having this pain and like laying down, so it was like, it came like all at once. And it was like, that's when I remembered it. And I was like, whoo, I might cry. I might cry. And he's like, please don't cry. And I was like, I might cry. So we had the nurse in the room and she was like holding my hand and I had to like breathe through it. But like, that kind of stuff happens a lot when I'm at doctor appointments.
Makes sense. Yeah, anything can be a trigger. I mean,
I just renewed my ACLS like yesterday and the day before. They were talking about like intubating and I was like,
oh gosh.
And they're like, this is how you put that in. And I was like, they're like, oh, feelings of impending doom. I'm like, I've had that. And then everyone, because we were like joking and I'm like funny. So people were like, right now, right? I was like, no, like I actually had it. And they don't get it because they don't know, like they don't know. Right. But it was hard. It was hard for me and I was there and I had no choice but to do it. I have to do it for my job. And like, I was having like flashbacks while I'm in my ACLS class because I also happened to be like 8 months pregnant for Alec the first time I took it. So it just it was just too much, but I did it. It's over. I don't have to worry about it for another 2 years.
Oh gosh. Yeah. Oh my gosh.
The health anxiety is definitely there within the community for sure.
Yeah. I can see that. I mean, it's traumatic and
because like your body, right? They like, oh, trust your body. And then your body turns around and does that to you. And you're like,
yeah,
thanks. Wow.
Right.
I joined a page. I have a couple of pages of people who have no spleen. They have a lot of health anxiety. However, they lost their spleen and they worry. Sure. And I'm not there. I only got worried when I got pneumonia, but not so worried because I was already on an antibiotic. And then I just got doubled up on an antibiotic. And once I started feeling better, I was like, okay, I felt like that was going to happen. It happened and I took care of it. But I don't know that people are as in tuned with their body like as I am. So a lot of people with no spleens are freaking out over fevers. I'm not. And then I also have the understanding like viral versus bacterial.
Sure.
I also belong to a group that is called Living with Splenic Artery Aneurysm, even though I don't have it anymore, because educate. If there's pregnant women on there that were like, did anybody have this? Did anybody have theirs ruptured? Here I am. I'm a survivor. I can tell you what my symptoms were, you know? They have a lot of health anxiety.
Yeah.
Obviously, because you're like a ticking time bomb, and it's a bad, it's literally a bad bomb.
All right. So back at work, post all this trauma and everything. I know you kind of did an update on, was it the birth trauma mama? You had kind of, you had already gone back to work. Give us a catch up, like where you're at now, how things have been going at work.
So when I did that podcast, I was very close to leaving my job.
Oh, were you? Okay.
My mental health was suffering, and it was really hard for me to be there. I like went, and I had like gotten good, and then I had gotten bad, and I dreaded going there. And it just was like, we've just had such poor outcomes lately that it was really just triggering. Work. Yeah. Just really super, super triggering. And then like I had said earlier, I went on the Zoloft, and that has helped me tremendously.
Good.
I like look forward to going to work, and I just feel like when I'm there, what happened to me is just playing out all the time. You know what I mean? Especially when I get assigned to the room that I was in. Yeah. So it just, you know, I'm helping this mom have her beautiful delivery. And then it's like, you know, I'm sitting there like, yeah, I was dying in here.
Yeah.
You know, but it doesn't stick as much as it used to now that I'm on the Zoloft. So it's kind of like a fleeting thought, but sometimes it like hurts, you know, because I'm like, damn, like, I wonder how different my life would be right now if we didn't go through that. But I'm enjoying being back at work, and I've actually like caught 2 babies on my own, like provider, not in the room, like delivered babies, like first breath in my hand. And that has been like almost like reinvigorating my passion for my job. That was super exciting. Support at my job is like tremendous. Like my coworkers are so supportive. Good. They do everything they can to not send me back to the OR, because that is something that will bypass Zoloft. Super triggering. Like just because I feel like that's when I was really aware, like I'm probably not going to make it. Like I'm not going to wake up from this, you know, like they're putting me under, and like, this is it. This is my last place that I'm seeing, you know? So being back there is very, very difficult for me. I have not been able to overcome that part. But like I said, I got the support at work. So that's how I'm able to continue being there. Plus I'm still feeling called to that side of nursing. Like I'm still feeling called to labor and delivery. Like I'm not done here. I have something to do here, or something to say here, or something to teach here. And that's what I'm trying to do. Like on my unit, I want to try to start some sort of like trauma-informed care committee, or even just like a presentation, NICU trauma, because, you know, I had the best NICU team. He was in the best NICU, but that, and the result was a good result, but that doesn't mean that we as a family don't have trauma from the NICU.
Right.
You know, it's hard to feel like you need permission to touch your child, or you can't be a parent to your child because they're hooked up to all these things, or they're sedated, or whatever it is, you know, and the machines and this and that. And like, as a nurse too, like I came in and I want to take care of my baby and I can't, you know? So it was just, it was really hard. And we have a lot of lingering effects from it. And when my patients have a baby that needs to go to NICU, like I'm right there with them. I'm like, these are your resources. Get on Instagram, follow this page, follow this page, follow this page. You know, like it's going to help you. You're going to relate. You're going to this, you're going to that. And, you know, I need people to understand also, February is full term NICU awareness. Like not all babies in the NICU are preemies.
Yeah.
more than 50% are full term, like Alec was.
Yeah.
He was
Wow.
full term, so
Mhm.
there's this misconception that like the NICU's for preemies, and that's not it.
For sure.
If you do, there are pages for that too. And Dear NICU Mama is one that's really good. Yeah, Dear NICU Mama. And then I follow NICU.warriors.
Okay.
And I think
I've seen them too.
Project NICU is another one I follow. And then Empowering NICU Parents. And then I also follow the NICU doc just because he was like explaining HIE and stuff. So I was like following him.
Interesting. Cool.
So, so I feel like, advocating, I'm not as tearful as work as I used to be. Like that is something that would like really like get in the way of my job, is that I'd be like so overwhelmed. I would cry, or I'd hear a code 9 and I'd cry, and like, it would like stop me in my tracks. I hear it now and I don't like it. And I'm like, please shut that sound off. Sometimes I actually just recently, I was precepting this woman, and she was in the room. We had a difficult delivery, and the baby did wind up going to the NICU, and it was a code 9. There was a lot of people in the room, and the NICU left the machine, and it was beeping.
Oh.
And I was like talking something, and I was like, can you turn that off? But it like, I snapped, and she was like, oh, okay, no problem. And she just like turned it off. I'm like, I'm sorry. That was just like super triggering. And she was like, okay. And then I walked out of the room, and I needed to like breathe. And I was like, whoa, like that was not how I wanted to respond. So like when she came out of the room, I told her, I was like, I'm really sorry if I was snippy. Like that just like brings me back to my son being in the NICU. And it was just like in my head, and I just like, I lost it. And she was like, once you said triggering, I figured it was something like that. So I was like, let me get this machine out of the room. Yeah. Like she was super understanding about it, but I just didn't like my response to it. And I can't always control how I respond to certain triggers. I try to, but that was just because I was trying to do something, and then I heard this and I just lost it. It's like, but for the most part, like it's been great at work. Like I'm not coming home like miserable like I was. I'm not dreading going. Sometimes I have anxiety, and sometimes things are hard. But again, my team is so supportive. My coworkers are so supportive. Like if it's happening, like they got me. If they see it's hard, they'll pull me out of the room. Like I love the girls I work with.
Oh, that's awesome.
Yeah.
We got a listener question at Little Luna Sensory. Leslie, love her. She was on last week.
Hi.
Hey. So she asked for recommendations on how to face and deal with birth trauma.
Ooh, that's a good one.
Yeah.
I think the first step is recognition. And kind of recognizing where the trauma is, what caused the trauma. Some people are going to face it head on, and some aren't. I did not. Being a nurse, dissociation is a very good skill of mine. But I think that number one is support. You need to have a good support system around you, because you're not going to be able to get through it without the support, because you're just not yourself. And there are going to be days where you could only give 2% of yourself, and you need to have people that understand that. I think early help, like therapy wise, is integral, because through your journey, you're going to go through so many ups and downs and face so many different emotions. You need a professional to help you sort that out and kind of help you learn how to deal with certain things, or learn how to process certain things. I know a lot of people have done EMDR. That's not a route that I went, but it is something that me and my therapist have been talking about recently.
My cousin does something with that. Do you know, like, I don't exactly know what it is though.
I don't exactly know what it is either. And I know the Birth Trauma Mama is like really big about it, but I know that it's not for everyone.
Sure.
Because I think it's about just like kind of like reliving it over and over and over until you get desensitized to it.
Oh, okay.
Which gotcha. I feel like I kind of am at this point. Right. I talk about it so often, but when I talk about it, it's like I'm just talking about it. If I have to sit down and really like think about it, it's very it overcomes me.
And that is draining.
Yeah, draining. That's what I've heard about EMDR too, is super draining.
Oh, I bet. I'm doing my little podcast like of all the stuff that I've been through just like in life and everything. And I had to take a break.
Yeah. No.
Like I did my first part, and then I was just so exhausted. And then like I typed out the rest, but I haven't even been able to get myself to record it yet because it's like reliving it is so draining.
Yeah.
It's so hard.
I know. I actually had started writing a book about the experience and I stopped. I stopped in like November and I haven't touched it because it was like to go into the type of detail that I need to go into so that a reader can either feel or picture it.
Yeah.
Like it really took a lot out of me.
Yeah.
And that was like I think that was a big factor in like why my mental health plunged too.
Oh, okay. Yeah.
So early professional help, having a good support system. And then some people may not agree with this, but this is the type of person I am, really leaning into those feelings, really feeling them. They're big, they're scary, they're traumatizing, they suck, but you got to feel them so that you know how to get through them. And I think also realizing that you're never going to be past what happened to you. You're never going to forget it. You're never going to be better than it, bigger than it. Like eventually with time, it may feel easier, but this is now part of your life. And instead of trying to control it, it'll only wind up controlling you if you do that.
Right.
You have to learn how to like walk hand in hand with it, accepting that it happened and learning how to integrate it into your life because this is who you are now.
Yeah.
You know, it's not all of you. It's not what defines you, but it's a part of you. It's a part of your life. Your brain chemistry is different. You think differently now because of this. So how are you going to continue to walk forward? You have to continue to walk forward with it. Yeah. That's what I've done. And sometimes it's easy and sometimes it's not, but that's just, you know, like parenting. Sometimes it's easy, sometimes it's not. Or literally with anything. Sometimes it's easy, sometimes it's not. But you have to have some sort of game plan because you can get so lost in it. And because that's who I was, do not be afraid to use medication as a tool to help you.
Yeah.
It doesn't have to be permanent. It can be temporary, but it's there for a reason.
Right. Yeah.
So.
Perfect. Love it. Nicolette, thank you so much again for joining me on this.
Thank you so much for asking me because I saw that you were like wanting, and I was like, I want to do this, but like I'm just going through it right now. So when you came and asked me, I felt like the weight was lifted off me. I was like, I would love to.
Yeah. And I love hearing like the parenting side too. And like,
I love talking about that.
Just hearing the whole like story, you know, I feel like you can't talk just about parenting without knowing what somebody's been through. Right. So,
yeah.
But thank you for coming on.
Thanks, Kelly,
really
so much. Yes.
Of course. And I'm going to link everything in the show notes of where people can find you. So,
okay. Sounds good.
Thanks again.
Thank you.
All right, friends. If there was anything that resonated with you today, please go ahead and leave a comment below. Let us know your thoughts. We'd love to hear about it. If you liked this episode, you're really going to like this one too. Check it out.